How does a lung biopsy lead to a wedge resection? Imagine discovering a suspicious spot on your lung during a routine scan. The next steps can feel confusing, but understanding how these procedures connect can help clarify your journey. When doctors find a lung nodule or mass that looks unusual, they need to figure out what it is. The first step often involves a lung biopsy, which is a procedure to take small tissue samples from the abnormal area for testing. Sometimes, this biopsy is done using a flexible tube inserted through the mouth or nose to reach the lungs. But if the nodule is in a hard-to-reach spot, especially on the outer edges of the lung, this method might not work well. In such cases, doctors may recommend a wedge resection. This is a surgical procedure where a small, wedge-shaped piece of lung tissue containing the suspicious nodule is removed. Think of it as carefully cutting out a tiny slice of the lung that includes the abnormality. The beauty of this approach is that it serves two purposes at once. It provides a larger tissue sample for a more accurate diagnosis and also removes the lesion entirely, which can be especially helpful if cancer is suspected. Wedge resection is usually performed using minimally invasive techniques, often called video-assisted thoracic surgery. The surgeon makes a few small cuts, about 5 centimeters long, through which a tiny camera and special surgical tools are inserted. Using these tools, the surgeon carefully cuts out the wedge-shaped piece of lung tissue, sealing the edges as they go. The removed tissue is then sent to a lab for detailed examination. This procedure is particularly useful when other biopsy methods have failed or are not suitable. It is often chosen for small, localized lesions that are not deeply embedded in the lung tissue. For patients with potential lung cancer, wedge resection offers a way to get a definitive diagnosis while preserving as much lung function as possible. Because it removes only a small part of the lung, patients tend to recover faster and experience fewer complications compared to larger surgeries. After the surgery, the small incisions are closed with dissolvable stitches, and a chest drain is usually placed to remove excess fluid or air. Many patients go home within a day or two, with a quick recovery and minimal discomfort. The connection between a lung biopsy and wedge resection is important because it shows how doctors can adapt their approach to get the best information and treatment for each patient. If a biopsy isn't enough to diagnose or treat a suspicious lung lesion, a wedge resection can be a safe, effective next step that helps doctors make confident decisions about lung health. Always remember to discuss your specific situation with your healthcare team, as they can guide you toward the most appropriate options based on your individual needs.